Okay. အားလုံးမင်္ဂလာပါရှင်။ကျွန်မနာမည်ကသစင်အောင်ပါ။ Cave မှာ Director တူဖြစ်ပါတယ်ရှင်။ကျွန်တော်တို့ Cave မှာဆိုရင်ပေါ့နော် COVID-19 situation နဲ့ပတ်သက်ပြီးတော့ကျွန်တော်တို့ပုံမှန်အစီအစဉ်လေးလုပ်လာခဲ့တာဆိုရင်အခုဆိုရင်9ချိန်မြောက်တော့ရှိပါပြီ။ခါတိုင်းမှာလည်းကျွန်တော်တို့အလင်းသင်းသလိုသက်ဆိုင်ရာနိုင်ငံအနေနဲ့ပေါ့နော်ကျွန်တော်တို့မိတ်ဆွေနိုင်ငံတွေနဲ့ချိတ်ဆက်ပြီးတော့ကျွန်တော်တို့ဒီမှာခု live session လေးလွှင့်လာခဲ့ပါတယ်။အဲ့လိုလွှင့်ရတဲ့ရည်ရွယ်ချက်တွေလည်းအမြဲတမ်းကျွန်တော်တို့ပြောပြဖြစ်ပါတယ်။ကျွန်တော်တို့ဒီမှာနားထောင်နေတဲ့ပရိသတ်အနေနဲ့ပေါ့နော်တစ်ထောင်တနေရာနဲ့ awareness တွေရလာမယ်ပြီးတော့သူတို့နိုင်ငံမှာဘယ်လိုမျိုးကြုံတွေ့နေရလဲသူတို့နိုင်ငံမှာဘယ်လိုရင်ဆိုင်ဖြေရှင်းနေကြလဲစိတ်ပိုင်းဆိုင်ရာရုပ်ပိုင်းဆိုင်ရာဘယ်လိုကြော်ဖြတ်နေကြလဲဆိုတဲ့ဟာတွေကိုအချင်းချင်းဖလှယ်နိုင်အောင်လို့ဆိုပြီးတော့ကျွန်တော်တို့ဒီအစီအစဉ်လေးကိုစီစဉ်နေဖြစ်ပါတယ်သက်ဆိုင်ရာနိုင်ငံကလူတွေကလည်းမြစ်တာဖြင့်ပါဝင်ကူညီခြင်းဖြစ်ပါတယ်အခုဒီနေ့မှာတော့ကျွန်တော်တို့ဖိတ်ကြားထားတဲ့အဲ့ဒီကတော့ဩစတြေးလျနိုင်ငံကတက္ကသိုလ်မှာ lecturer အနေနဲ့တာဝန်ထမ်းဆောင်နေတဲ့ဆရာမဒေါက်တာဂျူဟာနာကာနတ်ဖြစ်ပါတယ်ဒီဆရာမဆိုရင်ပေါ့နော်သူကမြန်မာပြည်နဲ့လည်းမစိမ့်ပါဘူး2013ခုနှစ်မြန်မာပြည်မှာသူကဒီမြန်မာမှာရှိတဲ့လူငယ်အဖွဲ့အစည်းတွေရပ်ဘက်အဖွဲ့အစည်းတွေမှာလည်းသူကလာပြီးတော့သူ့ရဲ့တင်နန်းတွေပေးတာတွေသူ့ရဲ့အသိပညာဖြန့်ဝေပေးတာတွေတန်ဖိုးတာတွေလုပ်ပါတယ်ရှင်အဲ့တော့ကျမတို့ရဲ့ဒီနယ်မှာရှိနေတဲ့ center တွေမှာလည်းသူကအထောက်တနေရာနေပြီးတော့ကုညီပံ့ပိုးရလည်းရှိပါတယ်တခြားမြို့နယ်တွေမှာလည်းတခြားပြည်နယ်တွေမှာလည်းသူချိတ်ဆက်နိုင်တဲ့လောက်မှာသူအများနဲ့ပံ့ပိုးမှုတွေလုပ်ဆောင်နေတယ်ဖြစ်ပါတယ်ရှင်အဲ့တော့ကျမတို့ဒီနေ့အစီအစဉ်မှာပေါ့နော်သူတို့ကျမတို့တောက်လျှောက် live တွေလွှင့်လာတဲ့အချိန်မှာသူကလည်းစိတ်ဝင်စားပြီးတော့ကျမတို့နဲ့လာချိတ်ဆက်တဲ့သူကိုနှိုက်ကလည်းပေါ့နော်ဒီ COVID-19 နဲ့ပတ်သက်ပြီးမြန်မာလူငယ်တွေကြားမှာဘယ်လိုတွေကဆောင်ရွက်နေလဲဆိုတော့research ပေါ့နော်သူတည်နာစစ်တမ်းတွေကိုလည်းသူကိုယ်တိုင်လည်းအခုလုပ်နေရလဲဖြစ်တဲ့အတွက်ကြောင့်မလို့နှစ်ဦးနှစ်ဖက်အကျိုးရှိစေတဲ့အစီအစဉ်လေးဖြစ်တဲ့အတွက်ကျွန်တော်တို့သူ့ကိုဖိတ်ကြားထားခြင်းဖြစ်ပါတယ်အဲ့တော့အသေးစိတ်သူဘယ်လိုမျိုးတွေသူတို့နိုင်ငံမှာဘယ်လိုကြုံတွေ့နေရလဲသူတို့ဘယ်လိုမျိုးကြော်ဖြတ်နေကြတယ်နောက်ပြီးတော့သူ့ရဲ့သူတည်နာပုံစံတွေကဟောဘယ်လိုပုံစံတွေရှိနေလဲဆိုတဲ့ဟာကိုမြင်မြန်ဖို့အတွက်ကျွန်တော်တို့သူ့ကိုဖိတ်ခေါ်လိုက်ပါမယ် Hello မင်္ဂလာပါ
Mingalaba, good evening. It is nice.
Yeah, so can you tell what time is it now in Australia?
So now it's 8:30 at night.
Oh, it might be night. Really late for you.
Yeah, okay.
Thanks for your contribution and joining our program.
Thank you for having me.
Thank you. So first of all, would you like to introduce yourself to the audience, please?
Yes, so I think as Thazin has said, I am a lecturer in a university here in Armidale in Australia. So we are a small regional university. And I am interested, obviously being a sociologist, we study society and how factors and structural issues affect people's daily lives. And I'm very interested how politics and economics and cultural issues affect mainly young people. And I've been working on this for about 6 years, mainly in Myanmar. So although I work with many Australian young people, my interest primarily for my research has been in Myanmar. And I come over to Myanmar maybe once a year when I can to talk to people and travel around the country, gathering their stories about their experiences in Myanmar as the country is transitioning to democracy, following an industrialized development program. And of course, this is having negative impacts in many ways for particularly rural people with relation to the environment and food security. And I use these stories, and I use these stories when I teach here in Australia. And of course, people are very, very interested in what life is like in Myanmar. And like people in Myanmar and around the world, of course, now we're all coping with COVID-19, and it has changed our lives quite dramatically. It's also changed my teaching, and it's changed my research as well.
Yeah, I can imagine for that. So may I know when did it start happening? I mean, the first case that found out in Australia.
Yeah, so we are told now that the first case was in early January. But at the time, we weren't told. We didn't know this. But when we look back in retrospection, people say, yes, there were cases here in January. But we really didn't become aware of it till late February, and we didn't start acting until about the first week of March.
I see. It's a bit earlier, much earlier than Myanmar. Yeah. If I remember well, by the end of 2019, the country also suffered from the fire outbreak, right? Very big fire outbreak. So
Yeah.
then the COVID-19 hit. So how's the situation over there? How the government respond and how the people respond for that? Yeah.
Yes, so late last year, last year in Australia, we had a drought, very bad drought. Some say the worst
Yeah.
drought in Australia, and this
Mm-hmm.
resulted in the land being so very dry, and we had bushfires, mainly on the east coast of Australia. So
Yeah.
around Sydney, further south, but also here where I live. Where I live is very high, and we are very dry and
Yeah.
rocky, and the bush is very dry, so we had a lot of very
Yeah.
bad fires here. So already by Christmas time, people were sad. Many people had lost their homes. The business wasn't doing so well. There was a lot of anger with the government that the government hadn't responded adequately to the drought for the farmers and then
Mm.
to the bushfires. So they weren't giving,
Yeah.
to the people. So in January, we were starting to talk and criticise the government's lack of response and policy to the bushfires
Mm-hmm.
drought. And as you
Mm-hmm.
say, then we got COVID-19. So
Mm-hmm.
many people were saying in January that perhaps we were in a recession, an economic recession, and that the government needed to start what we call bailing out people by
Yeah.
offering money,
Uh-huh.
welfare, and
Social welfare. Uh-huh.
money to invest so that they could get their business
Uh-huh.
up and running again.
I see. Wow. Yeah. Yeah.
Mm.
I see.
Uh,
So, uh-huh.
that's okay. Mm.
Yes. Well, at the same time, I heard that, well, before we are on live, I even asked to you about the vaccine because Australia is one of the earlier country that try to do the vaccine research for COVID-19, right? Which is
Yeah.
also the urgent need in the world. Yeah.
Mm. So
Could you tell about us to the audience?
yeah, so my understanding, because we haven't had a lot of talk about a vaccine recently. So very
Uh-huh.
early on, my understanding is that the government gave $5 million to one university in Queensland, where they have
Mm-hmm.
the labs and the scientists to start
Yeah.
looking for a vaccine. Now, this was some
Mm-hmm.
time ago, but I haven't heard much talk about it, and it hasn't been in the media. There was some
Okay.
talk that so if I go back to March, as you
Yes.
say, we acted quite quickly.
Yes.
Um, so the country was closed down in March. The
Mm-hmm.
government realised by then that the majority of cases, I think, like in
Mm-hmm.
other countries, were from people that were coming back into Australia from
Ah,
other
yes.
countries.
Uh-huh. Same like Myanmar. Mm-hmm.
Yeah, exactly. I think
Mm-hmm.
the problem was we have many tourists, we have many people traveling for business, people who live
Mm-hmm.
overseas who wanted to come home, and
Mm-hmm.
unfortunately they were bringing the virus back with them. And
Uh-huh.
so the government acted quite quickly, and the first thing really that we did was shut our borders. So
Mm-hmm.
the country was closed. So
I
nobody
see.
was allowed to fly out, and they were
Yeah.
starting to limit who was flying in. So that
Mm-hmm.
was a very quick response. So we were then put into lockdown, like I think you
Yeah.
had in Myanmar, and our
Yeah.
lockdown really didn't start easing until about the 1st of June. So it's quite early.
Mm.
and many people
Mhm.
said that we would have to stay in lockdown until we got a vaccine. And that
So,
was,
oh,
yeah,
so
crazy.
which mean you were stay in a lockdown
Mm.
situation. I see.
Ah,
Well,
yeah. Mm.
I see. In Myanmar, as far as I understand, we never have a lockdown situation. Well, we use stay at home. Yeah, the
Yeah.
government announced a policy of stay
Mm.
at home, and it will
Mm.
be released or it's extended to end of June. So
Yeah.
soon we hope that it will be released. But
Yeah.
stay at home means it's not totally locked down,
Mm.
except those specific area where there has a positive case.
Yeah.
But now it's a lockdown situation. How could you manage your organization supplies, like especially food supplies, medical supplies?
Yeah,
Yeah.
but you're right. You're right. I'm possibly using the wrong term because we weren't locked down like England was.
Uh-huh.
So we were more a stay at home. But I think when I
Oh,
said lockdown, it was more the country was.
I
So we,
see.
that
Mm-hmm.
nobody can come and go. But yes, for the people in Australia, we were
Mm-hmm.
more to just stay at home. So we
Uh-huh.
had to leave our businesses and where we worked and work
Mm-hmm.
from home. So we were all sent home from our work, unless
Mm-hmm.
you were an essential service like a doctor or a policeman, woman, nurses,
Mm-hmm.
uh, and the shops. So the food shops were allowed to stay open. So
Oh, okay.
anybody who was an essential worker could still go to
Yes.
their job. Also,
Mm-hmm.
some of the schools stayed open. Most of the schools shut, but some schools were allowed to stay open for children whose
Wow.
parents didn't look after them. So, say
Mm-hmm.
you were a nurse and your
Yes.
child, you had nobody to care for this child, they could go to school. So
Okay.
everybody had to stay in their home. You couldn't go and visit your family. You couldn't visit your friends. And you were
Yes.
only allowed to go out to go and get food,
Ah,
mainly.
I
Yeah.
see. So I think many people might improve their cooking skill because since
Yes,
the restaurants are closed, yeah, or
definitely.
get a
Mm.
new skill of cooking. Well, that's
Mm.
we have to think the positive sides, isn't it?
Yeah,
So
yeah.
yeah. So what
I
about
agree.
the medical supplies? For example, I heard that there's a lot of shortage happen in the world. For example,
Mm.
in Australia, you also have shortage of the toilet paper,
Oh,
and
yeah.
in many countries, shortage of masks. And what
Mm.
about now? Is it fine now about the
It,
supplies?
it's okay now. So, yeah, what was
Uh-huh.
interesting is I think people got afraid because it was
Yeah.
so unusual and people got scared. So,
Yes.
when they said you all have to go home, now you have to be in your house, you're right. All the shops, all the restaurants, all the coffee shops were closed.
Yes. Yes.
Um, but we still have here, we have, like McDonald's or KFC.
Yes. Uh-huh.
Okay, so KFC and McDonald's could stay open and you could drive through in your car. So
Oh,
you,
interesting.
yeah,
Uh-huh.
you can
It's like
drive through,
takeaway.
yeah, takeaway, but only
Mm.
in your car. So,
Mm.
so here in my town, there is a KFC, and sometimes
Mm.
at dinner time, there would be like 20 cars all lined up to
Wow.
get KFC for dinner. So people
Wow.
do that. But mainly
I see.
people got very worried that we might run out of
Mm-hmm.
food and of supplies. And the first
Mm.
worry was that people were going to get very sick and they wanted to
Mm-hmm.
make sure they had enough goods to look after themselves if they got sick, like toilet paper,
Mm-hmm.
tissues, and medicine.
Mm-hmm.
So people went to the shops and they took all that. They bought as much as they could, and they
Mm-hmm.
bought rice and tinned food and food that you could stock up on. And that
Mm-hmm.
meant that the shelves were bare and that the shops didn't restock quickly enough. So many people couldn't buy toilet paper. Many people couldn't buy food. One day I went to the shops and there was no meat at all. They had taken all the meat.
Oh,
Yeah.
oh, wow, it's bad.
Yeah.
Yeah.
Yeah, it was for a little while, but not very long. It only lasted a few weeks.
I
And then
see.
everybody had what they needed. And then we have very big warehouses, and the shops put on extra staff, and they made sure that they restocked and that we had enough supplies. The main problem was for the old people, that the old
Yes.
people didn't get what they needed. So they made special policies for them. Yeah.
I see.
So, yeah. So for me, for somebody like me, I live at home. I'm on my own. I can grow some of my own food. I had enough food. I was okay. But maybe if you had a family, or if you were an old person, then there people had some troubles, definitely. Yeah.
So,
But
yes.
I was just going to
So,
say, in a rich
yeah.
country like Australia, though, there's no problem. We have everything we need. You know.
So, for the case of those who are in need, is there any? Well, I know that Australia is rich of the generosity. Like you also have a lot of aid program across the world. So, what about the civil society organization role during COVID-19 for those needy people there? How do they respond? Do they have a big role in Australia?
They do, but I don't think they have as big a role as they do in Myanmar. We
Mm,
have what we call benevolent societies and community organisations and voluntary groups, but they had to operate differently too, because they weren't allowed to interact with people. So
yeah.
all the shops were shut down. Normally where they could help people, and this was a problem for them. Say if an old person needed toilet paper, it was hard to get toilet paper to this person because of the isolation. So they had to operate differently, but they were certainly still making food parcels, helping children and helping for the old people. But they definitely had to change the way they did things.
Yes.
If you were to leave food, you left food on somebody's doorstep. You couldn't go and see that person.
Yeah.
And I mean, I didn't look into this in any depth, but I know that they were having problems here in my town because they
Yeah.
couldn't, the staff had to stay home in their home. You know, you can't have
Oh,
going around. So it was a little bit of a problem. But here in my street, so I have a street
yeah.
with some old people here
Mm-hmm.
and my neighbours, and I think everybody just looked out for each other to make sure that everybody was okay and that everybody
Good.
had everything they needed. Yeah,
Yeah, that's very good. That's very
yeah,
good.
yeah.
And
It was,
yeah, I also would like to ask you the one that you mentioned about the school. I heard from you that some of the school are still open, and how people manage, whether there's a government policy for social distancing or how, and also how the children reaction, because this never happened to them. For the adult people, we can organize it. We can, okay, this is happening, and this will also pass. But for children, they might not understand that. Did you see anything about it? Yeah.
yeah. So
Mm-hmm.
the majority, the very big majority of children had to go
Mm-hmm.
home, and so they went back to school about 3 weeks ago. So now the children are back at school. So what they
Mm-hmm.
did for the children, they had to stay home, and the teachers would send them some schoolwork home, so that the
Mm-hmm.
parents then had to be the teachers. Uh,
Okay.
yeah, so this was crazy for many, many people, mainly the mothers who got this extra work. So some
Yeah.
mothers were having to work from home, say in their job, and then they had their children at home and they had to teach the children as well. So this
Mm-hmm.
put many, many pressures on families. And a lot of children, for them, yes, it was very, very difficult. And I think the main thing was they missed their friends because, you know, children love to play with their
Yeah.
friends. They spend all day together, and
Mhm.
they had to just be at home with their mum and dad and their brother and sister for a long time and not
Yeah.
see anybody. And I think this was the hardest thing for them. And also they shut down all the playgrounds and the parks. You were allowed to go for a walk as long
Mhm.
as you did social distancing, and you could ride a bike. But
Mhm.
for the children, there was not so much for them to do. So I think you said before about learning to cook. We hear many, many stories about people getting skills, you know, and sewing and making things, and that's a real positive. And
Yeah.
I've talked to quite a few mothers who've had their
Yeah.
children at home, and a lot of them have said they really enjoyed it. You know, they like having the children at home because their lives weren't so rushed.
Yeah.
They could have their own routine. They did cooking with the children, you know, and they played games and they had fun. And for some people,
Mhm.
they really liked it. But
Mhm.
many, many families that don't have the resources and can't cope, and that's put a lot of pressure on
Yeah.
families. Yeah,
Yeah.
a lot. We've seen a big rise in domestic violence here.
Oh.
Um, yeah, there's been a lot of pressures on many, many families, unfortunately. So,
Yeah, yeah. This will be my next questions about that,
mm,
because I
mm,
heard from different countries, including Myanmar as well. People after people they cannot go out. Even those
mm,
who like traveling cannot travel. They've been staying at home for long.
mm,
Somehow the psychological part has been hit. So
mm,
now you already explained about the domestic
mm,
violence, which is really
mm.
terrible because this being set up at home and it's hard for those. So they release their pressure to their partners, which is really bad.
That's right. Yeah.
And yeah, is there any other positive things? How people did you hear any story that people overcome about their
Mm,
psychological things of this
yeah.
broken up situation?
Mm. Yeah, no, you're right. There's been a lot
Mm-hmm.
of talk about the mental health, poor mental health, and loneliness for many people, mainly the old
Mm-hmm.
people that live alone and also young people. But
Mm-hmm.
yeah, I mean, people, because we're so lucky, I think in our modern lives, we have the internet, we have social media,
Mm-hmm.
we have TV, uh, we have our computers. So people have been really, really creative in how they've connected with each other. For
Mm-hmm.
example, like you're doing now, and you
Mm-hmm.
know, Zoom so that families can get together. Having dress
Mm-hmm.
up nights where people get all dressed up and have a party, or they might watch a movie together but watch it online.
Mm-hmm.
Um, Many people started, and this is a real positive, I think, and I've heard this from many people have started growing their own food. Um,
Mm.
Talking before about the shops and that
Yes.
fear, you know, you could possibly run out of
Yeah.
food. And we've
Yeah.
never been confronted with that before in our lives. So if
Mm-hmm.
garden, many people have turned up their gardens or got pots and started to plant their own vegetables. Uh,
Yes.
so what ran out in the shops as well were all the seeds that you couldn't buy seeds for. They all ran out. It was great. Um, yeah, and a friend of mine grows plants, and he turned his plants into vegetables, and he sold them all because that's what people
Oh.
want. You know, it's so that's a real positive. I
Uh-huh.
think another positive is people saying that their lives slowed down. And I
Mm-hmm.
think, you know, we lead such busy lives with people working and taking kids to school, and then they play sport, and then they do their voluntary work. Uh,
Mm-hmm.
and in Australia, because we're a big country, people have to drive a long way sometimes to go to their job, or they go on the train, and it takes them an hour and a half to go to work, and then they have to come home in the evening. And a lot of people said that because you didn't have to leave the house, your work was where you worked. You slowed down. You had some more time for yourself. And I think a lot of people really enjoyed that, and they don't really want that to change.
Yeah,
And
that's
sorry.
Yes, please.
So we are still working from home mainly. So now the schools are open, the restaurants a little bit, the shops a lot, the parks and the playgrounds are open. You can go to the doctor, you can go to a dentist now. Things are more normal like that, but you still have to do social distancing, so stay away from people and be very, very careful not to go out if you're sick in any way. But we're still not going back to our offices. We're still working from home. Yeah. So they're saying a lot of people don't want to go back to the office. They want to
they enjoy the current new now.
The new normal.
The new normal. So you just mentioned that you can go out now, right? To go to the shops and to go to the pubs. But how people protect themselves? Do they have to wear masks all the time, or they also wear the face shield as well?
No. So there's no policy, there's no law or legislation, only advice in Australia. So they say, so what we have to do when you go out is stay 1.5 meters away from another person. So in the shops, they put a mark on the floor where you have to stand, and they have rules everywhere in the shops as to, how they want you to behave, what they want you to do. Last night, I went out to a restaurant on my own to have some dinner, and they put me on a table a long way away from all the other people. And I have to write my name in a book and leave my telephone number. So if somebody gets sick, they can tell me that person was in that restaurant at the same time as me.
That's good. It's like a contact tracing.
Yeah, like contact, very simplified, really simple thing. I don't know if it's so in that restaurant, they had, you have to wash your hands with hand sanitizer when you go in. So you have to wash your hands when you go in. Yesterday, I went for an appointment and they checked my temperature. And if I had a temperature, I wasn't allowed in, but I was okay. They say that you should wear a mask if you are worried. If you think you're sick or you're worried you might get sick, they say you should wear a mask. And we did run out of hand sanitizer and masks for a little while, but now we have a lot of them. And wash your hands when you come home. So they're saying when you've been outside, when you come home to your house, wash your hands and wash everything.
I see.
And that's the guidelines from the government now.
That's quite similar with us, but the only different thing is here, when we go out, we have to wear masks. It's recommended. But in Myanmar now, what I see is that people has less concern. Well, they would like to be as usual. Because Myanmar people, we are not fit in with the new normal. For example, the tea shop. So in the tea shop, they like to talk more and more. Sometimes, even though we have a plastic cover, there's a screen cover. So we have a kind of more. It's a policy from government. So our government made we release part by part. So first, the government release the restaurant to open, but they have to follow the guidelines. So in the guidelines, the mandatory is they have to put the social distancing kind of shield. So depending on the restaurant, their budget. Some of them they put the plastic, just the plastic one, or some of them they put the fiber one, but the transparent fiber that people can see each other from side to side. And some
Wow.
they try to they don't put a lot of chairs. They reduce
Yeah.
the table and chairs, but
Yeah.
still the majority those go and eat. I saw that in the tea shop, even though they make the table like side to side, but like face to face, but they don't sit face to face. They sit side to side. So the other side is open, even though there's a face cover. So
Yeah.
this is the example that how people become less concerned on the
Absolutely.
on the
Yeah.
prevention. So it's hard to say. Even
Mm.
for myself, I hardly ever go out, and I was thinking because I now making many discussions with my friends from different countries. Different country has a different situation, and especially in Southeast Asia, for example, like Cambodia, Vietnam, and Myanmar, we are not so high in the in a positive rate. But still, Myanmar is next to India. India
Mm.
now is facing a very high rate, but people become have less and less concerned because we no longer have that case, and then the positive case are only, as you mentioned, like in Australia, only from imported
Yeah.
case mostly happen.
Mm.
So yeah, so that might also be a concern because the Ministry of Health and Sports has a big concern about people, those who become less concerned.
Yeah,
Yeah.
and that's what's happening here too, because you go to the shops and you see
Mm,
people close and they don't, they come near you and you sort of don't want
mm,
to. We have a new outbreak now so we have states here in Australia. We have
mm-hmm,
7 states, and um, they've so some of the states shut their borders so that you
mm-hmm,
can travel between one state and another state because
mm-hmm.
different states have different policies and governments and rules, and then we have the federal government over the top of them.
Yeah.
And we have the state of Victoria, that border was open between New South
Mm,
Wales and Victoria, but now just today I think they have 33 new cases there, and they're
oh,
worried because some of that was from outside, but now they're worried because it's community to community transmission. And
mm-hmm.
so they're now saying that nobody is allowed to travel to Victoria and no Victorians are allowed to come and travel anywhere else in Australia. They should all stay there now. Um,
Mm-hmm.
and they have to get stricter again about their hygiene and their social distancing to try to stop the spread of a new wave. So,
Uh-huh.
yeah,
So
they are.
it's like isolate the states.
Yeah, well,
That's
they're isolating. They want to isolate 6 areas. There's 6 little areas, and then maybe
mm-hmm.
I don't. But again, people say no. I don't
Yeah.
care. It doesn't worry me. I just keep
Yes.
traveling. So
Yes. Yes.
everybody's.
So what I know that you have many beaches. What about the beach now? Are they closed or open now?
They closed the beaches, so the beaches
Mm.
were open, and then one day about 50,000 people went to the beach, and yeah, it was a bit crazy. My children live at this beach, and they rang me and said, "Oh, Mum, this is really silly." And the next day,
Mm,
the government shut down the beach. So then,
mm,
from that time, the police then came out onto the streets, and the
mm,
government enforced fines. So if you went to the beach, or you went to an
mm,
area you weren't supposed to, or if you were outside of your house for
mm-hmm.
a non-essential reason, you got fined
Yes.
$1,500. Well, it was $750 or $1,500, which isn't
Oh,
money, but it's a
yeah.
lot of money for people who are poor and who have lost
Yeah.
their job. So the government made millions of dollars in fines, fining people.
Oh, wow. Wow.
And
Well,
flooding the beaches, you're right. We love our beaches in Australia, and that was a really big thing to do, to say to
yeah,
people, you're allowed to go to the beach. Yeah.
I see.
Because many
Yeah.
people argued that when you're outside in the fresh air, you're safe,
Mhm.
which is okay.
Yes.
So, yeah.
Yeah.
That was it.
But
They're open now. They're open now.
I see. But you might be a little bit calm comparing with Europe, because now
Mm,
Europe is getting warm. People like to go out, so more
yeah,
people become crowd in Europe. So
yeah,
facing, but in Australia now you are getting into the cold season. How to
yeah.
call
We're
it?
in the middle of winter. Well, it's winter. Yes, so
Yeah, kind
very,
of winter. Yeah,
yeah,
so people might not want to go out. When you go out, you feel cold.
yeah,
So,
yeah. That's right.
so
Yeah, not as much. But they did say that, yeah, and you're right. But they said that winter is a problem because more people get sick
mm,
in winter, and they thought
yes.
COVID could get worse in winter. But one of
Yeah.
the positive sides of everybody being inside, like you said, in
Mhm.
winter, is that
Mhm.
people are healthy. So we
Mm.
haven't got COVID, but we don't have the flu and we don't have colds and we don't have stomach
Mhm.
bugs going around.
Oh,
Normally in winter, people get very sick, but
mhm.
people aren't sick because we haven't been seeing each other. So we've not had transmission of other illnesses. So,
I
yeah,
see.
sort of a
I see.
positive in a way. Yeah.
Regarding with the health system, if a person found out tested as positive, and then
Hmm.
how the government treat, whether the government send them to the facility quarantine or just let them stay at home, not to go out like other European countries do. What about in Australia?
Yeah, stay at home if you have a
Okay.
home. Um,
Mm-hmm.
so people coming in from overseas had to go to hotels to stay
Mm-hmm.
late in a hotel. If you're
Mm-hmm.
at home, you go to your home, and of course, if you're sick, you go to the hospital. And one of the
Mm-hmm.
reasons at the very beginning of COVID-19, because I think maybe in every country this is the same, nobody knew how quickly people would get sick or how many people might die. And they were
Mm-hmm.
worried that the hospitals didn't have enough space to treat everybody. And they
Mm-hmm.
didn't have enough PPE, personal protection equipment
Yes,
for
yes.
all the workers. That was a real problem in the beginning. And
Okay.
one of the arguments to keep us all at home was
Mm-hmm.
until the medical system could be prepared for large numbers of people to be sick.
Mm.
So they've put a lot of money into setting up wards in the hospitals and extra spaces, but we haven't had to use them because people didn't get sick. So we have a very low rate of infection and of death. So we've
I
done
see.
very well. Yeah,
That's good.
yeah.
In Myanmar, for the moment, I even read the articles about the COVID-19 response, because in Myanmar, how our government response is when the person was tested positive, they have to be in a facilities quarantine center, and
Mm,
then government pay for it. But now the report came up that the government has spent over billions of dollars for that. So we don't know, because it won't happen just now. It will happen for a long time.
yeah,
So personally, I don't know how long it will take. How long the government could handle.
yeah,
Because until now, even though the person was tested positive, but the health condition is good, they have to be in a hospital, in a facility hospital.
yeah.
So the government has to spend a lot of money for
Mm,
that until
yeah,
now. So we have over 260 something now. So those people expenses are from government expenditure. So
mm,
in the longer term, but I don't want to expect the government will get exhausted for that, because
yeah,
when I interview to many countries, especially the developed country, so European countries, and then now you mentioned Australia as well. So
mm,
the government let them, when they have positive, they have to stay at home. When they are in the severe condition, they have to go to hospital,
yeah,
right?
yeah.
But here it's not like that. So, well, that could all. On the other hand, that could also be the positive things, that we can still control the rate of the transmission,
Mm, yeah,
because, well, I also not sure if the government, that kind of policy was doing in Myanmar. I also not sure how people will react, because if they are positive, but what if they don't listen?
Yeah.
Even though the government recommend you better stay at home if you are positive, but what if they don't listen? And then we have
Yeah.
to make another security watch
Yeah.
for them. So the
Yeah.
current condition is so far work or fit with our country.
Yeah.
So yeah.
How
So
many people died in Myanmar?
sorry, die.
How many
Uh,
people have died from it in Myanmar?
6.
Is that
You
all?
mean yeah, the death rate, right?
Yeah, that's
Death rate is
incredible.
6. Yeah, 6 only. And those people already have other diseases.
Yeah. Yeah.
Like
Same here.
yeah, yeah. The rest of the people, no, is most of them. Very few people has a severe condition. Like
Yeah.
only the government announced only 2 or 3,
Mm.
but the rest are in the facility quarantine, but they are fine.
Yeah. That's
So
incredible.
yeah, yeah,
It's amazing, really. But
yeah.
I think you touched on the money spent, and this would be my sort of last point, really, is the economic cost has been
Uh-huh.
horrific. As we said at the beginning, we were already sort of heading towards a recession here in Australia, um,
Mm-hmm.
with many people losing their jobs and huge bills, to recover. Now we have
Mm-hmm.
6 million people unemployed, mainly young people. The government
Mm-hmm.
is trying to bail out many, many people. They've put a lot of these workers on a welfare system that runs till September. I think it's till the
Mm-hmm.
1st of September. They've put
Mm-hmm.
a lot of money into certain industries like airlines and the arts industry and
Mm-hmm.
education and childcare and aged care. It's cost the country billions, yeah, beyond hundreds of billions of dollars. So I think the financial costs now, we're in a recession, and it's a
Yeah.
recession that could last 3 to 5 years. So
Mm-hmm.
we're going to have to rethink how we're going to care for our vulnerable people here, mainly young people. Also,
Mm-hmm.
we have many homeless people. We're a very, very wealthy country, but we have a very real inequitable distribution of wealth in this country. And
Mm-hmm.
I think the government has done a good job in many aspects, but this should be a lesson now to them to start reviewing our social policies in Australia. It's a
Uh,
really important opportunity now to, say, what do we really
yes.
want for our country, and how are we going to look after people and make it more equitable for everyone.
Mm-hmm.
Because so many people here are so incredibly wealthy, but they
Mm-hmm.
benefit from the poverty of other people, like, around
Mm-hmm.
the world. So
Mm-hmm.
yeah, I really worry for young people now who don't have jobs. Um,
Yes. Yes. That's a global issue. Yeah.
yeah,
Yeah.
mm,
About the jobless matter, and even before COVID-19, I think it's been about 10 years that
mm,
we when I was in the one of the European exchange program, it was been happening in even in the wealthiest country like in Finland. They have well, government security is very good, but still there are
mm,
also young people with a jobless. Unemployment rate is quite high for young people, so they've been also finding the way. And now,
mm,
when we have faced COVID-19, and then there are other people who are try to develop the IT, like robotic things. So
mm,
that will be substitute to the
yeah,
our daily life, and then you can imagine how the job sector will hurt, because they're gonna substitute with a human being, and then the well, it's happening now in Singapore and other countries now. I think even in
yeah,
Australia, you
yeah,
were
yeah,
developing technology, so you
yeah.
might also have it. Yeah.
Yeah, see, just last week, for one company said they were going to automate their warehouses with, robots.
Mm.
So Now 700 people lost their job just from that one. And that's really, really worrying. So we're hearing a lot of job losses now. Also today, we have a very big airline here, Qantas. They don't fly to Myanmar. But they have laid off 6,000 workers. 6,000 workers.
Wow.
We have another 15,000 workers whose jobs are pretty insecure. So we're not creating any more industries at the moment. We have a lot of job losses, so a lot of job insecurity. And one thing that I think this is raised as well, when we look at it from a global point of view and globalization, a lot of people now are looking here at food security. It's a huge issue that Australia, for a long time, we were sending, so we import too much. And we import a lot of goods, cheap goods from China and other countries. We used to have a manufacturing base in Australia, but we don't anymore. And a lot of people now are arguing that we need to bring this back on shore. So we need to start looking at our agriculture industry again. We should be food secure ourselves. We shouldn't be reliant in any way on imports. And I think people are looking to rethink their consumption patterns and manufacturing, and, you know, there's many opportunities here that we could take from this, but these are all going to have global impacts. And if each country is thinking this, you know, that we have to be more sovereign, to be, you know, protect ourselves and protect our borders, we're going to see a real shift in global politics and global power and economic systems. So this, if it keeps going for the next years, which it looks like it might, is going to have huge ramifications around the world. The problem. I mean, Australia is an island. You know, we've got that in a way. Is a strength for us. But,
yes. And you also have and you also have many migrants, right? So that might also be another thing, because I'm not sure whether in Australia you are also affected by the Black Lives Matter that was happened in United States, and it spread to other countries as well. Is it also happening, like demonstrations happen in Australia as well?
Yes, well, so we have an issue in Australia here with our Aboriginal and Torres Strait Islander people, so the Indigenous communities in Australia, who were the First Nations of this land and who never ceded their land. We invaded them, you know, we're colonial invaders, and there's never been a treaty agreed between the First Nations people and the colonialists, you know, colonists, and been talked about for a very, very long time, decades, and the last 5 or 10 years in particular. But again, the government is sort of refusing to meet them and allow even institutional representation or representation at the federal level. And so there's been what we call a reconciliation movement here in Australia for a very long time. And so the activists in that movement and all their supporters have definitely come out in the support of Black Lives Matter. And so we had a lot of rallies about 3 weeks ago, and I think there's one more coming up this weekend. And thousands of people, tens of thousands of people gathered. It's a really serious issue in Australia that a lot of people support. The government were very angry with everybody because they didn't want people coming together and protesting. So there was a lot of bad media, a lot of bad press. Our Prime Minister was very angry at everybody. He's not necessarily supportive of it. And but it will continue, yeah, definitely. And it's good to see because it's rejuvenated a lot of issues and it's brought together a lot of groups. So I think the Black Lives Matter movement is amazing, particularly in America. I'm a bit sad in a way that it's lost momentum in a way. That's an important issue. And Yeah, no, people in Australia certainly, well, you know, so many people here in Australia support Black Lives Matter movement. So,
I
yeah,
see.
mm,
I see.
it's,
Yeah.
yeah.
Interesting. The next thing I would like to ask you is about your research thing, because I got to know that you are also planning to do the research about the youth and then the COVID-19 in Myanmar right now in Australia.
Mm,
So
mm.
would you like to share a little bit more so that the audience can also know what you were like to do the research and how it could affect to the people? Yeah.
Yeah, so it's just an idea. So here, obviously, with COVID-19, anybody who's doing research now, we need to also include COVID-19 and how it's affected the people that we work with. So,
Mhm.
because this is what we would call an existential crisis. This is a crisis on so many layers. So it's, you know,
Mhm.
individual, it's social, it's cultural, it's economic, and it's political. Sorry, my my battery's going to run out in a minute. Sorry.
Oh, oh, it's okay.
It's okay. We'll be finished by then.
Yeah.
And I thought I had it enough. Uh, so so
Yeah.
now we can't ignore COVID-19. So I'm
Mhm.
very interested in, I think you touched on this, I'm very interested in civil society. I'm very
Yeah.
interested in how people have cared for each other in COVID-19
Yeah.
because the state, the government, although your government has responded and my government has too, they have not done enough. There is no way the governments of the world have considered the really marginalised people and the vulnerable groups in COVID-19. Their
Mhm.
prime concern has been the economy and to protect the economy and business. And it is, as you said before, civil society. As I said, it's my neighbours on the street, it's families, it's your friends that are caring
Mhm.
for each other. And so and some colleagues of mine here at the university, and we're meeting tomorrow to talk about this,
Mhm.
uh, want to find out. We want to know from organisations like yourself and social workers and people who are out in the community how this COVID-19 has affected them in their daily lives, how it's impacted them, how it's made them feel, and
Mhm.
how they're responding to it, and who is providing the care in
Yeah.
lieu of the state. You know, if the state's not doing it, and we know they're not, and we know this
Mhm.
is going to go on now for a long time,
Yeah.
where is the money and the resources and just the everyday physical support going to come from?
Mhm.
Um, and I think this is of interest because COVID-19 is not going to be the last pandemic.
Mhm.
Now in our very global modern world where we, you know, interact and we move around so much in our trade, um, this is going to be something that we're going to be faced with again, and we
Mhm.
need to know how we can look after each other when it happens again. And so we need to be, you know, have an understanding of what works and what we
Mhm.
can try next time. And I mean, it could also be that we need to work on how we could make ourselves more resilient to
Mhm.
pandemics or economic recessions that are going to happen because of pandemics. And I think that's probably a better thing to focus on is making ourselves more resilient. Um,
Mhm.
you know, like growing our own food, being more aware of food security, being more aware of community support networks, how we can set up programs to, you know, for health advice,
Mhm.
you know, teaching skills for people.
Yes.
Because I think the stronger we are as a community and the less reliant we are on the state, the more
Mhm.
resilient we ultimately are. And
Exactly.
you know, and I've always found that the community develops more sustainable and enduring programs than the state does anyway. You know, we tend to
Mhm.
be more long thinking than the state does. The government quite often is just thinking very short term, you know, because they, you know, short term economics, and they know they're going to get elected in a few years, and so they don't really care. Whereas the community understands intergenerational impacts, they understand environmental impacts, local problems, and I think that's where we need to be focusing our research and our resources. Yeah, that's what I do. And so that's what I'm interested in. Many people are doing this in Australia now. So there's a lot of research now on how people have coped and who's been doing caring in Australia. And it's something that I'm talking about with my students here. So when I talk to them about government policy and I talk to them about environmental issues, we talk about this, about building community resilience. And it's something I'm interested in to learn about from Myanmar as well. So I think, you know, if it's something you're interested in, that we, you know, I like to document people's stories, gather this information, and then obviously, you know, write up reports on what we think works and doesn't work.
Yeah, that's really useful and very interesting to know about it, because this is very related with what we are doing now. Well, when the COVID-19 hit, it's we as a civil society organization would like to do something for the community. And then we cannot go out, and then we mainly do for the aid change, and then we think of this kind of program. So it's very related. It's very relevant.
Yeah, I think so.
Yeah, I love to work with you more to in the future, and if you have any other related things that we can assist, we are happy to support it. Well, I think I have other questions, but it's not the major questions anymore, because I think your laptop is run out of battery. So.
It's like,
so would you like to say the last comment or some suggestions or advice to our audience? There's some viewer there.
Well, I know for one thing it's sad because I won't be able to come to Myanmar for a long time, and I was hoping to come this year in October and stay for a few months. So we have a farm now in Rakhine State, and I wanted to go and visit. And of course I can't do that now. But yeah, and I think that what we need to do is take this time to think about how we might be able to live differently. So as you said, many positive things have come out of this, and I think we need to focus on those and say, well, it was okay. You know, we learned to do this, and we learned to cook, and we can manage without these things, and we can look after each other. And maybe this is a time to reflect and think about the things that we might be doing wrong in our societies. I think it's a great lesson. I think this is a really lovely time to be learning. It's made life very hard for many people, but I think it's given us all a chance to look at how we're connecting now. We didn't do this before COVID-19. We didn't think about it. You know, it's making people connect in different ways, and that's a good thing. So, yeah.
Yeah. Thank you very much for giving the time and contributing and sharing the information. Well, last time I met you, and then we talked on tea shop, and still I learned something from you. And now we talk, and then I know down a lot that I learned something from you as well.
Well, there's so much to say. It's such a big thing, but thank you for the opportunity to talk.
Thank you. We will send you a link later to your messenger as well. Thanks for giving the time, and have a nice evening.
Okay, bye-bye.
Bye-bye.
Bye. Do I just close it now?
It's okay. One our team member will let you do it. Yeah.
Okay.
Please take care.
I will email you. Thank you.
Thank you. Take care.
Bye.
Stay safe. Bye-bye.
Okay, you too. Bye-bye.
Okay,အခုဆိုရင် ပြိတ္တကြီးအနေနဲ့လည်းချီးကျူးသူများအနေနဲ့လည်းပေါ့နော်ကျမတို့အခုအင်တာဗျူးသွားတဲ့ဆရာမဂျိုဟာနာနဲ့ပတ်သက်ပြီးတော့သူ့ရဲ့အတွေ့အကြုံတွေသူမြင်သမျှတွေသူဖတ်ထားတဲ့စာတွေအများကြီးပဲဒီ COVID-19 နဲ့ပတ်သက်ပြီးဘယ်လိုတုံ့ပြန်နေကြလဲဩစတြေးလျမှာဘယ်လိုတွေဖြစ်ပျက်ခဲ့လဲဆိုတဲ့ဟာတွေကိုတစိမ့်တည်နာအနေနဲ့နားထောင်ကြရမှာဖြစ်ပါတယ်အဲ့တော့ဩစတြေးလျနိုင်ငံကဆိုရင်ပေါ့နော်တကယ်တော့တော်တော်ကြီးကိုတခြားနိုင်ငံတွေမှာလည်းအမျိုးမျိုးကိစ္စအမျိုးမျိုးဒီကြုံတွေ့ရတာမှသူကတော်တော်ပြင်းပြင်းထန်ထန်ကြုံတွေ့ခဲ့ရတဲ့နေရာမှာပါပါတယ်အားလုံးလည်းသိပြီးကြဖြစ်မှာပါနော်ဒီ COVID-19 မတိုင်ခင်ကလည်းတော်မီတွေလောင်တာကိုတော်တော်ကြီးကိုခံစားခဲ့ရတဲ့နိုင်ငံလည်းဖြစ်ပါတယ်အဲ့ဒါမှနလန်မထူနိုင်သေးခင်မှာပဲအခု COVID-19 ထပ်ဖြစ်တယ်သူတို့နိုင်ငံငကူကတော့ဒါကျွမ်းဝတဲ့နိုင်ငံတွေမှာပါတဲ့ခါကျတော့သူတို့ရဲ့တုံ့ပြန်နိုင်တယ်ပေါ့နော်တုံ့ပြန်နိုင်ရင်လည်းအထိုက်ရောက်တော့တုံ့ပြန်နိုင်ရင်လည်းထိခိုက်မှုတွေကတော့ရှိသေးဖြစ်ပါတယ်အဲ့တော့လူတွေကဒါပေမဲ့လည်းဘယ်လိုမျိုးဘယ်လိုတွေ့ခက်ခဲတဲ့ဟာတွေပဲကြုံတန်နိုင်ဆုံးကောင်းမြင်ဘက်ကနေပြီးတော့ကျော်လွှားဖြတ်သန်းနေကြတာကိုလည်းနားထောင်ခဲ့ရမှာဖြစ်ပါတယ်အဲ့တော့သူပြောတဲ့ထဲမှာကျွန်တော်နောက်ပိုင်းကျရင်တော့ဘာသာပြန်တင်ပေးမှာဖြစ်ပါတယ်အခုသူပြောတဲ့နေရာမှာကျွန်မအနှစ်ချုပ်လေးကျွန်မမြင်လိုက်မိတာပေါ့နော်နောက်ဆုံးပြောသွားတဲ့စကားလေးပါတကယ်လည်းမှတ်သားအခု COVID-19 ကျွန်တော်တို့ကြုံရတယ်ဒီကယောဂါကြီးကဒီတစ်ခုပဲနောက်ဆုံးလာသွားတာမျိုးမဟုတ်ပါဘူးနောက်ထပ်ဒီကယောဂါဒီတိုင်းလည်းပြီးသွားမယ့်အရာလည်းမဟုတ်ဘူးနောက်ထပ်တခြားမတူညီတဲ့ကယောဂါလာကောင်းလာနိုင်နေတာဒီပဲဒါကမ္ဘာသမိုင်းမှာလည်းအစဉ်အဆက်ကယောဂါတစ်မျိုးပြီးတစ်မျိုးလူသားတွေကကြုံတွေ့ခဲ့ရတာဖြစ်ပါတယ်အခုလည်းကျွန်တော်တို့ COVID-19 ကြုံတွေ့နေရတယ်လက်တန်းမှုကိုကျွန်တော်တို့ဘယ်လိုမျိုးနဲ့ကြုံရကြမလဲကျွန်တော်တို့နီလန်းပေါင်းစုံထောင်လန်းပေါင်းစုံစူးစမ်းနေကြတယ်ပေါ့နော်နောက်တခြားကယောဂါတွေကြရင်ရောဘယ်လိုမျိုးကျွန်တော်တို့ကြိုတင်ပြင်ဆင်ကြမလဲဆိုတဲ့အထီအောင်စဉ်းစားနေကြပြီဆိုတဲ့ဟာကိုကျွန်မကအဲ့ဒါလေးကိုနည်းနည်းလေး highlight လုပ်ချင်ပါတယ်အဲ့တော့သူပြောတဲ့နေရာမှာလည်းနောက်ထပ်လေ့လာစရာလေးတစ်ခုပါပေါ့နော်ကျွန်တော်တို့ဒီမှာလူသားတွေကအချင်းချင်းတင်ယူရင်းနဲ့ကုညီနိုင်ပြီးရင်းနဲ့ကျွန်တော်တို့နီလန်းတစ်တွေရှောက်ပြပြီးတော့ကျွန်တော်တို့ဒီကြုံတွေ့လာတဲ့အခက်အခဲတွေကိုကြုံလာမှာဖြစ်ပါတယ်အဲ့တော့ပြည်သက်ကြီးလည်းအခုကြီးစုသူတွေအနေနဲ့ပေါ့နော်နောက်ဒီလိုမျိုးအခက်အခဲတွေကြုံတွေ့လာတဲ့အခါကျရင်ကြုံလာမှုနည်းနည်းလေးရှောက်ပြနိုင်ပါစေလို့ကျွန်တော်တို့ပြောနေဒီစီစဉ်လေးကိုဒီမှာပဲညီကိုချုပ်ပါတယ်အားလုံးဆက်မချလာကြပါစေတဒါ